But just really delighted to be here today and to have the opportunity to give a very brief, I suppose, snapshot from the perspective of Community Leisure UK. So I guess for those of you who might not have come across us before, we are a membership association. So we represent charities and social enterprises that are delivering across public leisure, sports and culture, and that's right across England, Scotland and Wales. So we've currently got 113 members of varying shapes and sizes across the UK, but all very much in that kind of public leisure culture space, and all non-for-profit and charitable organisations. So for the purposes of this afternoon, I was going to just have a little bit of a chat. So I've not prepared any slides. It's not a formal presentation as such. I suppose it's more some reflections from the perspective of our members that we thought might be useful and hopefully interesting to share this afternoon. So I'll kind of outline a little bit of the landscape that our members are currently operating in, and then touch on some of the lessons and the opportunities, and then kind of ending on a little bit around the whole systems approach. So starting off, I suppose, in terms of the landscape for public sport and leisure, I mean, obviously the last couple of years have been a roller coaster, as they have for all sectors. And I'm not going to go into too much detail around, the challenges of COVID, but I think it's important in terms of the context of the pandemic, that we have that in mind as we begin to hopefully look forward to emerging from the pandemic in the kind of years to come. So from the perspective of our members, currently they're in quite a financially fragile position. Reserves have been used over the last couple of years really to support organisations through the kind of challenging times, through the lockdowns. So we're at a position where, members have kind of not got that safety net, that financial safety net, which is important. And we're still kind of in that recovery period. So it's quite a lot of unknowns and uncertainty across the landscape. Venues are still being used, quite a lot of venues across the country to support, vaccination centres and some of the kind of COVID, the pandemic support that's been offered to local authorities and health partners. So again, it's not quite a back to normal. It's not a kind of all venues back operating. There's still a little bit of adaptation and flexibility as things gradually move and kind of reopen. We've seen customer return rates across our members increasing since reopening after each of the lockdowns. But I guess we're now at a position where we're seeing that really flat line around the kind of 70-75% of compared to pre-COVID levels. So it's slightly challenging in terms of not being back to kind of hopefully full kind of membership. But one of the key questions really that our members are asking is not just around actually trying to get back to pre-COVID levels, but it's actually who are the missing kind of 20-25% that haven't returned. And I think that's quite important that we kind of reflect on that, because it's often, and anecdotally, we know that some of those 20-25% of people who are not returned are those that are more vulnerable, those that are experiencing perhaps more anxiety at returning to kind of public spaces, at returning to indoor places. And as restrictions lift, which is obviously welcome, there is an increasing anxiety among certain communities within the population around going back into activity, particularly indoor activity, and a real challenge there on how to kind of engage those people in a way where they feel safe, where they feel supported to come back to doing activity, whatever it was that they used to do kind of pre-COVID, and making sure that they're not becoming inactive as a result of anxieties around the pandemic. So we've seen quite a lot of different approaches across the country. Everything from moving activities outdoors into kind of the open air, which is obviously, as we all know, kind of weather dependent, to using kind of shelters with kind of open ventilation to again kind of increase feelings of safety, security, keeping some distancing, keeping a lot of the kind of hygiene measures from the pandemic, to provide that reassurance to customers that they are in a safe and supported space. And I guess the kind of, final sort of landscape bit that it's kind of important, I guess, is, as we all know, is increased costs. So whether that be as a result of the pandemic and some of the processes that are in place in terms of safety, but also, as we're all more than well aware, the increase in utility costs that is beginning to kind of really bite and is set to continue to rise. So particularly looking at some of those facilities that have quite intensive use of energy, our ice rinks, our swimming pools, large venues in particular, are going to be significantly impacted. And again, against that kind of reduced income from reduced footfall. So quite a challenging position for the sector in terms of kind of public leisure. But I'm kind of not going to dwell, hopefully, too much on the negatives. But as I said, it was probably just to frame some of what I'm going to talk about within that context. But I guess we've also reflected quite a lot on, what's been learnt from the last couple of years. We've seen huge adaptability, flexibility, new approaches, things being tried that probably wouldn't have been tried as quickly were we not in a pandemic situation. So whether that's kind of use of virtual or kind of moving things outdoors, we've seen individual supports for those that are more vulnerable within communities being sent out activity packs, exercises, doorstep visits in some of our members' case, where they've had qualified gym staff going onto the doorstep with those that are perhaps identified as being at higher risk of falls. So really trying to make sure that people's kind of physical well-being and activity is not as impacted as it might be by the lockdowns and by the kind of pandemic restrictions that we've been living under. So there's been a bit of time to, I guess, stop and think about, things that maybe weren't working pre-COVID, but, kind of continued on because people were kind of caught up into kind of business as usual. So there's been quite a lot of reflection around, changing customer behaviours, both as a result of the pandemic, but more generally that might have been happening as people kind of look to adapt lifestyles. We've also kind of seen really, I guess, the kind of unique offering of public leisure in the sense that it remained open. I use open kind of in inverted commas while venues were closed. So we did see that actually, they were not kind of furloughing entire staff. It was actually very much looking at pivoting the supports to telephone check-ins, to virtual, to engaging with customers in a different way, to supporting the pandemic effort. So I guess that's kind of shone a little bit of a spotlight on how we can keep people active, how we can keep engaging with communities while venues were closed and we were perhaps in that lockdown position, which has been kind of really positive, I think, and we've really tried to shine a bit of a light on that for our members. The work that they've done right throughout the pandemic, which has not stopped. And I guess one of the questions we've been thinking about as well is, we've talked a lot, and there's been a lot of talk in the media from politicians around well-being over the last couple of years, physical, mental well-being, using your kind of time that you had to be out, during lockdown, get out, be active, and increase we've seen across communities of people actually being maybe more aware of their kind of physical well-being and the kind of upturn we've seen in cycling and walking and all of these activities. But how do we harness that message so that we don't actually go back to where we were, pre-COVID? Actually, how do we make the most as a sector, and I use sector in the kind of widest sense, to actually make sure that people continue with some of those behaviour changes that they might have adapted to during the pandemic. So there's, I guess, we're probably moving towards the new normal, if we can use that phrase. But there's probably some learning in there that we really want to kind of take with us and make sure that that's not lost, as we kind of move back through the recovery phase. How do we actually make sure that people continue, as they've adapted, we've adapted to hybrid working and everything else, but activity, where does that fit within that? How do we keep people engaged and active How do we keep that focus around the impact on physical and mental well-being? And I guess that's a question, for everybody that's kind of involved in the sector in the widest sense, but certainly something that we've had numerous discussions on with our members. And I guess, kind of linking to that, there's opportunities for public leisure sport to support health well-being for their communities, and this is nothing that's new. This is something that's absolutely embedded. We talk a lot with our members around being in that well-being space. So a lot of our members identify as well-being organizations. So rather than kind of leisure or sports, which is part of it, but what they do is actually much broader, and their kind of purpose is really around promoting and supporting community well-being in their local areas. So we've started doing a little bit of trying to understand, what does that really mean? So we know that, if we look at the 2019 pre-COVID figures, across our members, there was £1.5 billion of social value generated through the activities that they are delivering, which is really quite an eye-opening figure. But it's really what does that actually mean for communities? What does that mean on the ground? What is that social value actually delivering in terms of impact? And for us, it's really around a lot of the work that's going on, working with health partners, social prescribing. There's a huge amount of work around supporting people with long-term health conditions, a whole range of different conditions, and tailoring activity to make sure that those people can be active, but also can enjoy being active and can gain that social support as well from being part of an activity that is appropriate for their conditions and their kind of fitness levels. So it's about tailoring offers and making sure that things are inclusive. Also looking at kind of recovery from those that have had health problems. Previously there was a big focus on cancer, on stroke, and getting people moving again, getting people active. We're seeing more of that at the moment around long COVID. So people that have perhaps been more severely impacted by COVID, and making sure that they are again supported in a safe way to get back to what they were doing previously, to get back to what it is they enjoy, or to engage for the first time if that's not been part of their lifestyle previously. And that, the kind of health support covers a range of conditions, and risks such as falls prevention, is a key one as well, that's delivered right across the country, as well as those people that are perhaps looking to get into exercise and activity. So we know there's, not a huge amount of the population that's kind of, really keen to go to the gym. There are those for whom that is absolutely, their kind of go-to. But there's a lot of people that have expressed interest, and if we look at some of the data that's out there, there's a huge amount of the population that says that they would like to do exercise, they would like to get into activity. And it's understanding what are the barriers to those people and how do we address those barriers. Is it the accessibility of facilities? Is it the offer? Is it the times of activities? Is it the range of activities? So again, we've got quite a lot of work going on right across our membership, looking at some of those barriers and trying to understand how they can tailor things. Is it that the facility is intimidating? A lot of people, won't want to go into a gym setting, if that's not something that they're comfortable with, if they don't have the confidence. So how do we get supports? Is it a buddy system? Is it the use of volunteers? Volunteers to support people and to kind of perhaps provide a softer introduction into some of the activity. So there's really a lot already going on, but there can be a lot more. And I think, when we've kind of chatted around, how do we make an offer to our kind of colleagues in health? And it's around, there's three things really that we can kind of consistently offer across the country through our membership. One is, a skilled workforce. So within the membership, all of them have a range of colleagues who are highly skilled in delivering activity, in and whether that's for people with long-term conditions or more generally. So there's a great wealth of knowledge across leisure and sports, and a workforce that's really willing to kind of engage with people and get people active. So there's that passion as well as the skill sets within the workforce. There's also assets. Our members operate over, I think it's over 1,800 assets across the country. So there are physical buildings and places that people can go to, and a network, for health to be able to tap into. So we've got the workforce, we've got the assets. And third, and probably most importantly, is the reach into communities. So our members are community-based organisations, very much focused on, prioritising, tailoring what they offer to meet the needs of their local populations, and being able to engage with people. They all are, as I said, charitable organisations. They're all run by boards with people from the local area. So there's a real kind of connection between the leisure trusts and their local communities. So it's how do we use that infrastructure of people, assets and reach to better connect and support health and to upscale some of the great work that we already know is taking place, and particularly where we have pilots that have got great evidence base, getting some fantastic results. There's a prehab for cancer program up in Greater Manchester, which is a phenomenal program, and it's run across a number of different organizations, and really providing excellent results. But when we see good practice, how do we take that, how do we share that better, and how do we look to not necessarily roll out in a blanket form, but actually kind of take the learning and share it in an appropriate way for different areas across the country. So there's a real opportunity, I think, for leisure and sport to continue what it's doing, but also to do more, to look at prevention and to look at how the link between health, leisure, sports. And I guess for us, underpinning that is the idea of fun. People want to do something that they enjoy. I mean, we're all human, and that's, kind of part of human behavior is that, if it feels like a chore, if it feels like something we're told to do, it's probably going to be more difficult. But having something that's fun, but at the same time is providing that well-being support is key. So I guess there's a bit of a kind of call to action, both for us as a sector in terms of, what is it that we're talking about? Is the language that we're using the right language if we want to engage with health and if we really want to deepen that connection, and kind of make it more of a partnership approach, and really see ourselves as part of the wider public health system, which I think certainly is where our members would see themselves, is supporting around a lot of those kind of wider public health outcomes, and a real role and an opportunity to do more, and to work kind of hand in glove with local authorities, local partners, and health partners as well, and that kind of joined up approach. Which I guess sort of leads us on a little bit to kind of think about, there's a lot of talk at the moment around the idea of a whole systems approach. And for us, it's, where do our members fit into that kind of whole systems? There's a lot of kind of policy context, which is great, but actually when you translate that into reality, how do we make those connections? And for us, it's really around that place-based approach. So it's understanding what a community needs. What is the community? Who's in that community? Who are the partners that are involved? And what are those connections? And kind of really joining up in terms of delivering outcomes, because that's the way we're really going to kind of make it more meaningful, is when we're having shared outcomes, and our members will have a part to play in supporting the delivery of some of those outcomes. They're not going to be able to deliver outcomes, for a whole local authority area, but they will be a key partner, and it's understanding the connections. So I think, we've seen a little bit more connection through the pandemic as well. People working much more closely together, probably because, we had to. And again, how do we take that and how do we look at this whole systems approach, and how do we make sure that sport and leisure, physical activity is within that? How do we make sure that as a sector we're articulating what we contribute across a range of different policy areas? So we've probably traditionally focused on, the key policy areas that are very much core to the sector. But actually, if we look, across justice, across, transport, and obviously into health, actually, how do we articulate to those partners what the offer is? We're here, this is what we can do. We want to help, we want to support, to really have that kind of join up and kind of focus around the needs in a place-based way. So I guess that's a little bit of a kind of whistle-stop tour from the perspective of our members, but I guess a lot of it, applies much wider than our membership as well. We're one part of, the jigsaw in terms of, physical activity and sports sector, and then probably an even smaller part if we look at that kind of well-being sector. So, the question for us is, there is absolutely an appetite to better align leisure, sport, physical activity with health, well-being. But how do we get there? How do we do that in the most joined up way possible? And how do we make sure that as we move through the recovery periods, we don't lose sight of some of those lessons that we've learned over the last 2 years, but we use them to inform the direction of travel going forward. So thank you very much, Yvonne. I'll pass back to you now. But thank you for the opportunity. I was going to say this morning, but this afternoon.